Thank you, Mr. Chairman, and thank you for holding this hearing. This is a very important matter. It's extremely important to me and my practice, my group. You know, this has been extremely frustrating, and I wanted to ask Mr. Porter, what was the difference? What happened during the pandemic where we were able to quickly get new licenses, and then when the pandemic ended, we're now in this unbelievable delay? Is there any discernible reason why we are now in this huge delay, this outrageous delay that we're all experiencing?
Dr. Hauter, I'm not sure I have a specific answer for you, and perhaps the department might be able to shed some light on that. I agree with you. During the pandemic, things did seem to happen. There was more urgency to get licensed healthcare professionals. But I don't have any answer for exactly why that changed in the wake of sort of the end of the pandemic.
So if you agree that that sort of the renewals have been going all right, and we're trying to focus on these new licenses and these licenses coming from other states, what is a proposal from the medical society to speed this up? I heard that you said that we need more staff. I personally am not of the opinion that they need more staff. And I've heard a lot about a new computer system and new computer software. I've heard for years about that. What, if it's not enough staff, what can be sped up? Is it more online access for these new and coming from out-of-state licenses?
You know, I think something that would be really helpful is transparency. I think creating some sort of mechanism where applicants can check the status of their application from the very start so that they could, some sort of confirmation of receipt, checks are cashed, and, you know, if a couple weeks go by, they can go online onto the portal and find out exactly where their application is. So creating more of a process around that and providing real-time information to applicants so they know when they can expect to get licensed would be a good start.
Why is it so hard to get some sort of notification that they've received all of your application materials? I mean, that seems to be a basic part of licensing, that you would know that they received it and they received everything. Why is it so hard to take that step?
I wish I could answer that. I don't know the answer to that.
It's just, I mean, I can get really hot and bothered about this subject, so I'm going to try to not be. But as someone who's in the healthcare field and seeing it firsthand, and knowing the big thing for me that I know, and you represent the physicians, you know that patients are suffering. Patients are going without care, and it's real, and they're going. I know in my group. You know, we had to have, and there's a big increase in the mobility of medicine. And so many people are coming as locums physicians, locum CRNAs, locums nurse practitioners, and on. And they're coming from other states. So we're competing with other states. And to take care of people, we have to compete with other states. What happens when a surgeon, let's say from Indianapolis, is getting out of his residency and he has a job offer in Illinois and he has a job offer in Indiana, and he's deciding where he's going to take a job, a highly trained surgeon, and he knows he can make money and get a job in Indiana when he graduates in July from his residency, or a job in Illinois where he may get a license to work maybe November, maybe January of the next year. He doesn't know. He has no idea. Where are you going to go when you have the ability to take a highly trained, highly compensated job? Everybody knows all over this country the problems Illinois has. If you look at every state surrounding us, we are worse much worse, and it's embarrassing. I'm embarrassed when we compete for people from out of state. So I'm just saying, you were dispassionate, Mr. Porter, in saying, the problems. Maybe they need more staff, and maybe they need a notification. I want the people that are listening to this and the committee members to know that patients are suffering, patients are going without care, patients are going to other places, and it's outrageous, it's unprofessional, and the incompetence I see is it actually makes me furious, and I wish we could do something about it, but it sounds like we just have to continue to ask them to update how they license healthcare professionals. And I'll stop talking because I'm probably going to take up too much time.
Representative Hauter, we always appreciate your comments and your passion on this issue. And in all seriousness, Representative Hauter has been talking about this issue in our committee for quite some time and representing professional licensees that are reaching out to him and others about the delay. So I want to thank him for his work on this issue. And you will have other opportunities to ask questions as well as we go today. So with that, we're going to close this first panel. I do want to thank everybody, particularly from this first panel. You did a great job staying within your time allotted, and we thank you. And we thank you for being here and knowing this is just the first of many meetings and processes that we're going to keep working on to improve this. So thank you. Panel. We'll move on to Dr. Hauter.
All right, thank you again. Just a question for the pharmacist. I didn't get the name, but can you repeat again how many requests you sent in and what that period was? Did you say 12 weeks or 12?
So the period of time that the 70 requests were over was August of 2022 to October of 2022. So that period of time, and that's a busy time for pharmacy in terms of graduates and then new residents and people coming into the state. So that is one of our busiest periods for licensure for pharmacists. And it was more than 70 different applicants who had experienced some type of delay in their licensure, where those health system, ICHP members had reached out, or their directors had reached out to get some assistance in trying to streamline or get information to get their application processed. Did I fully answer what you?
Yeah, I think so. I just wanted to again, not only are patients suffering, but Illinois is really losing out on highly compensated employees. In this age where we're all trying to keep people in Illinois and bring people to Illinois, it's so important to Illinois' success that we keep these highly trained, highly compensated people in Illinois. And we're talking about some of the most highly compensated people in our economy. We're talking about physicians, pharmacists, nurse practitioners, PAs, CRNAs, veterinarians, even RNs. So we're talking about highly compensated jobs and the tax dollars that they bring. And these people are not coming to Illinois just because of a licensing delay. So it's just something, again, I want to just highlight to the whole committee and hopefully to the whole General Assembly of how badly Illinois is losing out. And I did have a question for Lindsay or for Ms. Wagenoff. So when your dentists are getting notification on how many business days they should wait, do you think that the department uses a random number generator, or did they use a spinning wheel to tell us how many days we're going to have to wait? What is your opinion?
That's a really great question for the department, Dr. Hauter. I don't know the answer to that, so I would direct that towards the department of how that timeline comes into effect.
Well, it's probably a spinning wheel because that's a little bit more fun, but I'll ask the department because there is no rhyme or reason to these delays. They just say 5 business days, 21 business days, 7 business days. I think it's probably a spinning wheel. Thank you.
All right. Thank you, Dr. Hauter. And again,
Secretary Trejo, thank you for coming. We're running up against a hard stop, so I just want to get some questions answered very quickly. How long have you been secretary?
April 1st of 2021.
Okay, so you said in there that there has been an increase. You said 13% increase in applications. That doesn't seem like a large number to me. I think that what we did during the pandemic to expedite licenses was very effective. Why can't we go back to that?
It's an issue of limited resources. You know, like I would compare this to, you know, you have $100 and I need to utilize those dollars in a certain way. If I apportion 25 to pursue a specific outcome, then I have 75 remaining dollars. During that time period, we again looked at all of our resources and directed them to focus on healthcare professions. Now, keep in mind, we have CPAs, we have real estate brokers, we have a number of other 120 plus licensed professionals that we need to account for. That was a temporary, and I'm thankful for this. It was a temporary issue that we needed to address. Now I needed to open up the resources to all the different professions, and it was a unique situation, which I acknowledge.
I just think this is a very unique situation. The department is failing. It's failing Illinois greatly, and you said some things that piqued my interest. You said that the software that you had procured has not worked out. Are you saying that we're going back to square one with the software, and that all this we've been told that there's software coming that is not working out, and we're going back to square one?
So the system that we have right now is that 1999 system I mentioned, and 9 months ago, as the head of this agency, my task is to find an avenue in which we can find a reasonable solution within the legal framework within which I need to abide by. And so when I looked at those three possibilities, I pursued one possible avenue. That avenue, again, 2 days ago, I was notified that there were concerns, and so I am going to have to go back to square one with a full procurement process. Now, I can't go into details with my next set of strategies as today, because as you know, I don't want to preclude a particular solution to become available because of any sort of perception of bias. My integrity, my ethical obligations to the people of Illinois, to our licensees, and to our consumers are the number one priority. So I'm going to continue to move forward with strategic intentionality, and I will make sure that as the next phase or the next approach is vetted appropriately, I will work with you and many others on this committee so that you're communicated what options are available to the department at that juncture.
Okay, but you're saying that basically we're going back to square one. Don't we have 49 other states that have licensing process that's working better than ours, that we can look at them, we can use what they're using? I mean, I almost feel like we should just contract it out to Indiana or Missouri and get this whole thing over with, because we get no answers. And I think what the chairman, it's very good they call this meeting. It's very bad that we don't have the software that we've been promised and that we're going back to square one. I think that one of the main things is we have to make this a huge priority. And you said, you can't go back to what we did during the pandemic. I think we need to. We need to really focus on making this a priority, because this is costing patients their care, their suffering, and it's costing Illinois highly trained professionals. I could go on, but the one thing that I would like you to look at, that I think would be quick and easy, would be some receipt that a person would get that all their information has been received and it's complete. And that seems like basic licensing procedures, and that's not done. And so many people are lost in limbo because they don't know that they haven't turned in anything, and then they go back into the back of the line. So there's so many things. I'm not going to take everybody's time. I know other people want to talk, but I think you need to look at this as a pandemic type of emergency. It's untenable to continue like this. People don't know when they're going to be licensed, and their livelihoods are at stake, and patients' lives are at stake.
Dr. Hauter, if I may, you and I align in the vision and the goals of this agency. And I, for one, value your commitment. As I mentioned earlier, as someone who was a former board chair of a federally qualified health center, I know the importance all too well from also personal experience that we need to make sure that the provision of critical care services are available in Illinois. With that, you made a couple of points that I seek to address. Number one, the system providing notice to our licensees. That's my vision, and that's what I would hope that we'd be able to do. Again, the system is from 1999. If you can entertain my analogy, in 1999, I think many of us used the Nokia 3200 as our cell phone. And when we think about what we utilize now and the capacities and the needs of modern day society, we can't ask that Nokia 3200 to take pictures, to navigate us, to do a number of different things that we need here today. That's the system that I have. It's from 1999, and I would love to be able to provide specifically tailored notifications to an individual that their application was received and processed accordingly, but I can't. The system doesn't have that capacity. So this is where I think there's opportunity for us to collaborate and work together in finding a solution. I think Chair Morgan alluded earlier to a fourth possibility, a fourth track, and that's emergency procurement. You mentioned the ability of possibly working with my colleague in Indiana. We created a Great Lakes Healthcare committee with my sister secretaries across the Midwest. And you are completely right. They all were similarly situated with Illinois, but they also have very different procurement rules. They have a lot more flexibility in getting some of the systems that they need. I don't have that flexibility. I'm very much, my hands are tied with what I can and cannot do. So it isn't an issue of going to Indiana and asking them to process applications for us. We can certainly do that. I just need to be able to access the system or the solution that can get us to where we need to go. And you mentioned Illinois and where we are. Illinois is a great state to live in, to work in. I can't be more prideful of that fact. It's a blessing and a curse to see, with nurses in particular, one nursing application type, we saw 288% increase in people wanting to get licensed in the state of Illinois. And I think that's because we're an amazing state. People want to work here. People want to provide those critical care services that we talk about. And so now I just need to meet that need of the people that want to come in Illinois and practice within the state of Illinois. NPR wrote an article during the COVID pandemic. They did an investigatory piece on how long nurse licensing was taking. And at that juncture, Illinois was highlighted as one of the top 5, and especially looking at similarly situated states. When we look at the states that we're comparing ourselves to, we compare ourselves to California, to Texas, to New York. No offense to my sister secretary at Oklahoma, but I've been in constant communication with him, and I'm like, Oklahoma has access to this gold standard licensing system. We need to get there too. So I think I'm confident that we're going to be able to get somewhere, again, in working with the short-term solutions that I presented earlier, but also in finding once and for all what that long-term solution is for the department and again, for the licensees of Illinois.
Thank you, Secretary. We're going to go to